live now, sir.
Good evening, all. This is Chandramohan,
We are live.
physiotherapist, Sri Samraj Physiotherapy Center, Dindivanam. A warm welcome to all for ExRx India's For the Students, By the Students web series. Today's second topic is post-menopausal symptoms and physiotherapy management. Will be presented by Miss P. Swathi from KMCH College of Physiotherapy, Coimbatore. I welcome ExRx India team members, Dr. Rupesh and Professor Duna. Now I welcome our resource person, Ms. Swathi, to present her topic. Please, Swathi.
Yeah, thank you, sir. So, good evening, everyone. Thank you for spending the coolest and peaceful evening with me. Myself, Swathi, and I'm from KMCH College of Physiotherapy, Coimbatore. Now, I'm doing my second year BPD. So, today we are going to see about an interesting and very much arresting topic, okay? That is post-menopausal symptom under grade PT management. So, first, what is menopause? Menopause is nothing but complete cessation of menstrual cycle. So it is a physiological and natural event in the life of a woman, but it may be pathological too. Uterus after menopause. So we can see in the left side, there will be younger uterus. In the right side, there is older uterus. So in younger uterus, there will be a normal membrane and there is a normal cycle. But in older uterus, there will be thinning of the membrane of vulva, vagina, cervix, vaginal dryness, irregular bleeding, loss of elasticity, and there may be shorter cycle of 1 to 25 days. So what is the reason? I'll tell you in the next slide. So this is, while talking about the vaginal environment, here comes a major hero, which is estrogen. So after menopause, estrogen level will get phased off because estrogen's mother ovary will not secrete that hormone anymore. I don't know the family problems and all. So coming to the symptoms of menopause, there'll be hot flashes, night sweat. So patient usually complains night sweat. So excess of sweating we can see in nighttime. Then fatigue, depression, mood swings, sleep disturbances, psychological disturbances. Actually, we have seen these symptoms somewhere else, right? So these are the symptoms of hypothyroidism. So many of menopausal like symptoms, even though they are taking estrogen also, they may suffer from undiagnosed thyroid disease. So these symptoms were actually associated with menopause. So the symptoms of menopause and thyroid disease come together as a best couple. Then the stoppage of menstrual cycle. Before that, I will continue with the symptoms. There'll be shorter menstrual cycle, vaginal dryness, and pain. We have already seen that. And weight gain, palpitation. So patients usually feel that this heart is beating too hard or too fast, breast enlargement and pain. So this is also the reason behind this is that estrogen only. Imbalance of estrogen is the reason. Then in skin, we have hot flashes, sudden feeling of feverish heat, dryness, itching, tingling. So why is this tingling sensation and all coming in this menopausal symptoms? So what is the relation? So the estrogen level impact our CNS, which means our nerve can get impacted. As a result, the tip of a body, finger, toes, hands, feet, arms, legs, can feel the tingly, prickly, numbness sensation as a result of this. Stoppage of menstrual cycle. So what is menstrual cycle? As we already know, it is the regular changes occurs in female reproductive system that make pregnancy possible. So let's see this as crazy point, right? The cycle is required for the production of oocyte and preparation of the uterus for pregnancy. Menstrual cycle occurs due to rise and fall of our hero estrogen. This cycle results in the thickening of the line of the uterus and the growth of an egg, which is required for pregnancy. So the egg is released from an ovary around day 14 in the cycle. The thickened lining of uterus provides nutrients for the embryo after implantation. So if pregnancy does not occur, lining is released, then this is what we call as menstruation. Then here are two heroes. One is estrogen. Estrogen is a very important hero. Second hero is progesterone. So estrogen effect, it will build up uterine lining, increases body fat, depression, headache, migraine, interferes with thyroid hormone, increases blood clotting, decreases libido, impairs blood sugar control. So this estrogen effect will get phased off after the menopause. Yeah. While looking at this graph, at menopause, there will be progressive decrease in estrogen and progesterone level. But while with estrogen level is somewhat higher. So this shows that 75% reduction will take place in progesterone only, but only 35% reduction takes place in estrogen. So estrogen level is somewhat higher. Then coming to the stages of menopause. Menopause, perimenopause, menopause, and postmenopause. So perimenopause, it is a period of 3 to 4 years before actual menopause. Decline level of hormones produced by ovary. So what are the changes during perimenopause? The same I have already said: mood changes, hot flashes, generalized weakness. That. So perimenopause is followed by 1 year amenorrhea. In this period, patients usually come across mild ovarian hormonal deficiency, which lead to consequences like anovulation and other menstrual disorder. Now let's jump into a big topic, that is menopause. Sorry, I actually made it very small only. So menopause, it is defined as the cessation of ovarian function resulting in permanent amenorrhea. So it takes 12 months of amenorrhea to confirm that it is menopause. Now coming to the post-menopause. Any bleeding from genital tract after 1 year of menopause. Normally, this is very important. Normally, a 1 year period of amenorrhea after the age of 40 is considered as menopause. So without amenorrhea or irregular bleeding, so if a patient comes to a clinic and if she complains that without amenorrhea or irregular bleeding, she continues to menstruate me around the age of 52 years, she need to rule out whether she is suffering from endometrial hyperplasia, malignancy of genital tract, or penile vaginitis, anything else. Now, our physiotherapy management. Hydrotherapy, yeah. Talking about hydrotherapy, yeah, it's actually an enjoyable therapy, right? So, as we have diamond qualities of water like mass, weight, density, relative density, buoyancy, hydrostatic pressure, surface tension, refraction, and reflection. Among all these physical properties, a physiotherapist should understand buoyancy and hydrostatic pressure of all those. They are our friends like that because the lateral pressure exerted and the effects of buoyancy together will give the feeling of weightlessness. So what will happen inside our body? We'll feel somewhat weightless. We will enjoy while swimming, right? Yeah. Then what will happen inside our body? Physiological effects. The blood supply to the working muscle increases. Heat increases. Why? The chemical changes taking place during contraction. So the heat is also increases. Muscle temperature increases. Metabolism increases. So there will be great demand of oxygen. Carbon dioxide production also increases. While talking about our therapeutic effect, it will relieve pain, muscle spasm, it will get relaxation, we can increase range of motion, we can re-educate paralyzed muscle, to strengthen the weak muscle, and to develop their power and endurance. So we just want to encourage them to do walking and other functional recreational activity. To improve circulation, the warmth of water, actually, this is very interesting, right? The warmth of water blocks nociception, okay, by acting on thermal receptor and mechanoreceptor. So if we suffer from any pain, if we give warm water, it will blocks the nociceptor, pain receptors. So they can be relief of pain. It will stimulate blood flow, which leads to muscle relaxation. It may reduce peripheral edema too. So what is my style is, I will tell you the explanation and I will tell you the effect and I will tell you one fact of each technique. Okay. So this is fact for me. Fact of hydrotherapy, hot tube hydrotherapy. Okay, it's a very effective natural migraine headache treatment. The postmenopausal women, she usually feel psychologically affected with headache and all. So this technique will relieve her and prevent migraine onset. Next one is strength training exercise. Women after menopause can do strength training exercise that engage all the major muscle group of the body. She feel pain, okay, in the area of hip, shoulder, legs, back, chest, arm. So we can give low impact training for women who cannot do high impact, okay. So while talking about the physiological effect, muscle mass naturally decreases with age, as we already know. It will decreases with age, but strength training will act as villain for this concept, right? So strength training increases bone density and reduces the risk of fracture. It makes joints stay flexible and can also reduces the symptoms of arthritis. So as you gain muscle, your body begins to burn calories more easily, making it easier to control your weight. Okay, this is the concept. Then coming to the fact of strength training, weightlifting. Weightlifting will boost the dopamine, norepinephrine, and serotonin, making it as a natural antidepressant. as we all need in our daily life, especially in this parental time. Next one is weight bearing exercise. So it works as, against gravity. So it also strengthens the bone. So almost around the age of 40, okay, we slowly begins to lose bone mass. Okay, so these menopausal women will affect from reduction in mass of bone. So about 10.2 million Americans have osteoporosis, and other 43 million are at high risk. Yeah, that's all. So according to Harvard Health Education, any activity that puts stress on bone stimulate extra deposition of calcium and the bone forming cells into action. So the tugging and pushing on bone that occurs during this exercise will actually provide stress. The result is stronger, denser bone. Yeah, the next one is aerobic exercise. Yeah, aerobic exercise are very enjoyable. Our annual day, sports day, something like cultural type related exercise. Yeah, dancing, swimming, water aerobic, biking, walking, hiking, climbing steps, low impact dance classes, kickboxing, cardio machines like treadmill, stair climbers, etc., etc., etc. So aerobic means what? Involving or requiring free oxygen. Refers to use of oxygen to adequately meet energy demand during exercise via aerobic metabolism. So the effects actually it is defined to be low intensity enough so that all carbohydrates are aerobically turned into energy. That's it. So it improves cardiovascular health, it lowers the blood pressure, regulates blood sugar level, reduces asthma symptoms, reduces chronic pain, weight loss, aids sleep, regulate weight. They strengthen immune system. Yeah. Researchers at Pennsylvania State University examined active and sedentary women and impact of exercise on their immune system. So one group of exercise on treadmill for 30 minutes. So one group of women were selected for doing exercise on treadmill for 30 minutes. Another group exercise, they'll do intense activity, which means doing activity very seriously and with concentration, often doing repeating deal in short time. So all women had their blood tests taken um, before and after and different interval in the days and week after these exercise sessions. So the result showed that regular and moderate aerobic exercises increase certain antibodies in the blood called immunoglobulin. So it's quite interesting, right? That so it ultimately strengthens the immune system. So let's keep it as a fact. Flexibility exercise. Flexibility exercise, also called as range of motion exercise, keep your muscle elastic and your joint to move freely. Stretching improves flexibility. So the effect includes it will improve posture and balance. It will provide a positive state of mind. A great strength. It prevents injury. A well-stretched muscle is more easily achieves its full range of motion. So women are more flexible than men. Yeah, it's a very proud information. Next one is Kegel's exercise. Now, yeah, as we already discussed the symptoms, urinary urge, urinary incontinence, or one among the symptoms of a menopausal women. So, in these circumstances, Kegels play a major role. Kegel is nothing but our pelvic floor exercise. Many factors can weaken the pelvic floor muscle in women, such as pregnancy, childbirth, aging, etc. So Kegel's exercise is very important for menopausal women. Then, if you feel pain in your abdomen or back after a Kegel's exercise, it's a sign that you're not doing them correctly. So we can correct this. Next one is weight loss exercise. Yeah, it's very challenging, right? So one form of estrogen called, I'll tell you the story. One form of estrogen called estradiol decreases at menopause. This hormone helps to regulate metabolism and body weight. So lower level of estrogen, lower level of estradiol may lead to weight gain. So from the first, I told that estrogen is hero, but at the end, estrogen becomes villain. Effects. The physiological process of fat loss occurs when fat are liberated from adipocyte into circulation to supply the needed energy. So what and all we can do to lose weight? Simple, walking. Yeah, just walking. Yeah, it's walking. A 12-week study in 20 women with obesity found that walking for 50 to 70 minutes, 3 times per week, reduced body and waist circumferences by an average of 1.5 percentage and 1.1 inches. Yeah, 3 times per week, 50 to 70 minutes, we can reduces our body weight. Jogging, swimming, cycling, strength training, swimming, yoga, pilot, all that. So fact is overweight or obese means we'll feel like a ghost is with us like that. So losing weight contribute to living a longer and a healthier life. Next, endurance training. Endurance training is the act of exercise to increase endurance. To counteract the, yeah, that's it. Endurance training is the act of exercise to increase endurance. Yeah. While talking about the breathing technique, North American Menopause Society found that spaced respiration is an effective technique for peri and postmenopausal women when practiced continuously. So, what is the spaced respiration? Yeah, it's a simple breathing technique. Sit in a straight back chair with feet placed on the floor. Rest hands on the abdomen. Slowly count to 4 while inhaling through the nose and feel the abdominal rise. Hold that breath for a second. Then slowly count to 4 while exhaling through the mouth. Let the abdomen slowly fall. So they prescribe to do this exercise for 15 minutes twice a day at the beginning of hot flashes. Okay. Next one is psychological support. Cognitive behavioral therapy can be helpful for anxiety, stress, depression, hot flashes, night sweats, sleep problems, fatigue. So most of the menopausal symptoms are treated by this therapy. Yeah, right. Already anxiety, stress, depression, hot flashes, night sweats, sleep problems, fatigue, 7. So it's very important. Then yeah, okay. Thank you for giving this opportunity. I would, yeah, I completed the session. I would love to thank John sir, Shanugapriya ma'am, and all the other faculties of this session for giving me this opportunity. I'll really thankful to you.
Thank you so much, Swathi. Very wonderful session, because even graduates, whether they are UG or PG graduates, hesitates or have some fear to talk about all these things. But being a second year BPT student, you came up with a good topic, and the way you teaching was very good actually. And I would like to thank Dr. Kalpana, principal of KMCH College of Physiotherapy, Coimbatore, to encourage her student to participate in our ExRx India's For the Students by the Students web series.